Jamaica now has 396 confirmed cases of the COVID-19, with the additional of 32 new positives over the last 48 hours. Of the 32 new cases, there are 11 males and 21 females, with ages ranging from 1 to 71 years. 15 are associated with the workplace cluster in St. Catherine. 11 cases are contacts of confirmed cases and 1 imported case, and 5 are under investigation. Of the 396 confirmed cases up to now, 202 are employees of the workplace cluster in St. Catherine. Their ages range from 18 to 53 years. They include 151 females and 51 males. They are primarily from the parishes of St. Catherine and Kingston and St. Andrew. In terms of classification, Jamaica now has 35 imported cases, 8 that are local transmissions, not epidemiologically linked, 108 that are contacts of confirmed cases. Of this, 108, 43 are contacts of the Alarica employees who have tested positive. Just to combine the numbers as it relates to the Alarica employees or the workplace cluster and their contacts, that would be 202 plus 43, which would take us to 245 that are linked either directly or indirectly to the workplace cluster of the total of 396. 202 that are local transmission related to a workplace cluster, as said earlier, and 43 that are under investigation. So far, we have done some 3,993 samples we have collected and tested. Of the 3,993 tested to date, in addition to the 396 positives, 3,567 are negative and 30 are pending. There are 385 persons in isolation and 89 in quarantine in a government facility. 7 persons have died. 29 persons have recovered. We have had in the last, 48 hours, 1 case of an individual who works with another BPO facility who tested positive. The employee, a resident of St. Catherine, has been placed in isolation at a government facility. The health departments in Kingston and St. Andrew and St. Catherine have begun contact tracing to ascertain those who may have come in contact with the employee with a view to quarantine or isolate, test, and treat as is appropriate. The BPO has been temporarily closed to facilitate supervised cleaning, including the HVAC system. Of note is that the management of that entity has been in compliance with the recommended social distancing. While scale testing of the staff is not recommended at this time, however, some employees will be sampled. In other words, based on the risk assessment, some employees will be tested. However, it is not determined at this time that the individual who has tested positive picked up the virus from the particular facility. However, it is important that we do the investigations to ensure that there is no presence of the virus at that facility.
At this point in time, the Ministry of Health and Wellness has been provided with approximately $2.8 billion for the COVID response. As at today's date, we have utilized of that amount approximately $2.5 billion. And so we have a balance of about $300 million that is to be utilized for the support of our activities going forward. However, we are now in negotiations with the Ministry of Finance and the Public Service for additional sums to be made available to the ministry over the next 6 months. And that negotiation is ongoing, and as soon as those numbers are finalized with the ministry, we can provide those numbers for you. Field Hospital. We are currently in negotiation with a contractor, and therefore I wouldn't want to compromise that negotiation by declaring who that contractor is. But we have utilized our emergency contracting procedures to have that contract let in the shortest period of time. And that negotiation is slated to come to some finality by next week, Wednesday, at which time we will have a public signing and the contract and the successful contractor will be made public. We have concluded negotiations with the Jamaica Defence Force, who will be the technical supervisors of the contract for the retrofitting of the national arena to be a field hospital.
The Ministry of Health and Wellness and all of government continues to urge the support, cooperation, and patience of the people of Jamaica in our efforts to disrupt the transmission of the virus that causes COVID-19. This is not a task only for the government, clearly, but for all of us. As we like to say, everyone counts. We need the people of Jamaica. We need everyone to understand that it will take some time to achieve our goal. I want to therefore use the opportunity to remind us to recognize our role. We use the hashtag #BeatCovid19 as a critical hashtag. Everyone counts as part of the promotion of all being involved and participating in the process. The team continues to work hard on the ground in St. Catherine, across Jamaica, at the head offices of the Emergency Operating Center, and it continues to be a team effort and will continue to be a team effort as we continue to overcome the risk of COVID-19.